We do need to find ways to make the jobs easier for people instead of hiring more people to make it easier for the doctors. Because you get to the point where the more you do for them, the more they want, and we can only give so much.
Well, thank you so much for joining us.
You're welcome.
We really appreciate you taking time
Glad to be here.
Sit down with us today. Would love to just start by hearing a little bit more about your story, your background. So what got you to where you're at today?
So I started out as a bookkeeper for a man that I was working for. He had 3, 4, 5 different businesses, and I just kept all the books and did that. Became the office manager, did HR, and then 17 years later, I'm like, this is so boring. I'm in an office. I don't get to talk to people. And so I thought, what else can I do? And I thought, I want to be a nurse. And I did. I went to school, nursing school at the age of 40. Like the oldest one in my class. But I had heart and soul and drive, and I liked it. And so became a nurse at the age of 40, and still didn't know which direction I was going into, because there's so many different ways to be a nurse, different areas. And one of my fellow students said, come to work in dialysis. And I was like, what? And she said, you'll love it or you'll hate it, but try it. And I did, and I loved it. So I did 7 years as a dialysis nurse. Wonderful, wonderful 7 years. And the doctor that I rounded with at the unit was the nephrologist at the practice I worked for. So I rounded with him for 7 years and then went to work for him as the clinical supervisor over the medical assistants in the office. So I did that. And then 4 years later after that, I moved into the administrative section of the business. And now I'm the operations manager, and I have nurses that manage all the rest of the staff. I'm over the mid-level providers. I do the physician schedules. So now I've done like everything.
What a story.
Fun.
What a journey.
It's been great. And we had lost some people at one time, so I actually did payroll and accounts payables, and now I'm glad I don't have to do that anymore. So now but I've done a little bit of everything.
That's awesome. So you can teach everyone else how to do that and keep them accountable.
Mm-hmm. And that's what I'm trying to do, so I can phase out in the next 3 years.
That's awesome. But you feel like the experience of going through all of those steps you just described has created a unique set of skills to be able to do the current role you're in now.
Yes.
That's amazing. It's amazing.
So with the role you're in now, with having your hand in kind of every aspect of the business, what does like a typical day or a week look like managing like a kidney care center?
I think I have to wear too many hats, and so when I come to work and I put my stuff down, usually somebody's either at my door or, and it's like, just a minute, let me put my stuff down. What's wrong? I am the go-to for everything, which is not really what I wanted it to be, but I don't tell people no. So if there's a problem with the server, they call me. If there's no toilet paper in the bathrooms, and it's like, why did I become, and you can see in my office, it's like a drop off. Oh, my UPS box stopped working here. And they just put it in my office, and I'm just like, the trash collector. But I don't care. I feel needed and wanted. So I will do anything for anyone, but my primary focus is the doctors, their schedules, and the rotations and where they go, and making sure they have staff. So, but it's everything.
That's awesome. Too many hats, but you've added so much value now, right? You're so valuable to the practice that you feel like you have great, and you said transition here shortly, but job security, stability, does it feel like you have a really solid place in this organization?
Yes. We had a change of leadership a couple of years ago, and they ended up firing the CEO we had, and the doctor told me, he said, no, you weren't going to go. You are the voice of Renalus. You are and it was probably because I was the stable one of all the people that were left. Because a bunch of people, I think 26 people walked out on that other CEO.
Goodness. So lots of value, lots of changes. So when you work for a large organization and you have a ton of changes at the top, and it directly affects what you do, and you have turnover to people that you've spent a lot of time with. How do you handle, right, sweeping changes in a company? One, stay there successfully, and two, like maintain like high morale or culture when those types of changes occur.
It's been difficult. We changed EMRs a year and a half ago, and it's been a struggle. It's been definitely a big struggle, but we try to look at it as, okay, it's just an obstacle on the way. We're gonna face it head on, and we can do it. That's why we're looking into the things we're looking at with y'all, because we do need to find ways to make the jobs easier for people instead of hiring more people to make it easier for the doctors. Sure. Because you get to the point where the more you do for them, the more they want, and we can only give so much. But it's been a struggle, but we're doing well. We've gotten the right people in the right positions, and I think we all just want the same thing. We just want to be able to come to work, do our job, and to the best of our ability, and have a happy work-life balance. Because that's hard sometimes.
It's hard all the time.
Yeah, especially with kids, and mine are grown, thank goodness. So, but yeah.
How do you find the right people and like train them and really bring out the best in them so that you can build a team around you to accomplish some of those things?
Well, we've actually had an employee that we hired that I don't even know if I was in the hiring of her, but she seemed very smart when we put her in a position, and it was like, okay, it's not working really well. So what do you do? Do you let them go? Because no, I said, let's find her strengths. So we tried her in another position, and it wasn't working because she was so detail oriented that it took too much time. So we tried her in a third position, and then it was like, okay, we're running out of spaces. Well, she had to fill in one day to help out at the front desk, and it's like this aha moment. So sometimes you have to find where they're suited best. I have great people, and they're wonderful, wonderful staff. But sometimes you just have to move them around to see exactly where they give you the best of themselves.
So then that's more the hiring side. Tell me more about, is it a challenge when you have a large team?
Yes.
Right? We hear this a lot. Talk to a lot of provider practices across the country. Talk about staffing as a whole, whether that's from the physician side, provider side, or the administrative staff. How is Daniel asked about like quality hires. Do you feel like there's a sufficient enough pool out there to draw from to actually get highly skilled people in every role that you're trying to look for right now?
No, I really don't. I think it depends on the job. We used to find great medical assistants, and we only have medical assistants working in the back with the doctors, overseen by a nurse. And we want them to be certified medical assistants so they can do prescriptions for the physicians. But they're just not out there. They're not the quality that we used to have. So when you do come across, we probably get 100 applicants a week. There might be one. And so now I say, if you find one, grab it, because they're so difficult to find. A lot of people want a job, but do they really want to work?
Is there a specific quality you look for in interviews or in people that you feel like, regardless of where we put them or where we find them, I know this person will figure things out type of thing?
Yeah, I think you get a good feel in the interview. And I've been told that we give great interviews because it's very relaxing, and people, looks like it'd be a great place to work because you're so comfortable to talk to. We can teach anybody pretty much to do anything, but their personality, I want to see that coming out, and that's what I want to see when you come to work. Don't come to work or interview really well and then come to work and I'll be like, go. But the good part is you can slide them back out. But I need people that want to work, that have the personality and the drive, because we can teach. how to check in and how to check out and do lab slips and all that. I want to see a personality. I want happy people.
Love that. So shifting more to your transition. So started in clinical, right? Worked as you said 7 years as an RN in dialysis, and then you go to more of this administrative kind of operational role, but you have a clinical mindset and kind of, I guess I would say, heart, right? Like you care a lot about patients and humans. So how do you balance the two, right? You go to admin, you're probably a lot about reports and data and analytics and efficiency, yet you come from a patient-centric background. When those two worlds clash, how do you balance that?
Well, I do walk back and forth, spend a lot of time in the clinical area, or try to, just to see how, and you see patients, and I'll see patients' names on the schedule, and I'll go, ooh, I'm gonna go over there, or I'll make myself a note and put a little message to go see, because I do miss the patient interaction, but not enough to want to do that full time again. I like where I'm at. I like what I do. And I get to see a little bit of it. I've had to talk to patients on the phone and calm them down because somebody made them upset, and I want to talk to your boss, so it comes to me. I get enough of that. That's good enough.
So you still like to do pieces of patient care and check in, but do you feel like your two role, like, so your current role, is it conflict with the idea? So again, I guess a better question is balancing high quality patient care while still maintaining, right, like margin and revenue from a business standpoint. Sometimes those two trains of thought, right, are conflicting.
Yes.
So how do you manage those?
The good part about my position is I am the operations manager for the west side.
Okay.
And we have an operations manager on the east side, and we're like yin and yang. So she's the business end. She's not an RN. She's not a nurse. So she does the business part of it, and I do the clinical part. And so together, and we work on projects all the time together, and it makes it nice to see it from a different, I look at hers. She writes most of the policies and stuff, and will ask me about them, and we'll do things together. We do a lot of projects together. We work on MIPS and any kind of compliance things we need to work on. But it helps by having her, because I can see the clinical side and she will see the other side, and she'll say, but, we need to do this. And I'll say, yeah, but what about this? And she's probably more clinical now than any of the other admin people we have, which is great, but it's because we work on these projects together. So I think she helps me where I am weak in that to make sure everything stays right.
What do you think your background as an RN, or what skills as an RN kind of helped you bridge the gap into like the operations role?
I mean, one of the doctors actually suggested that I go to that side. And it makes it easier, I guess, when I look at their schedules to know what they need to do, rounding in the dialysis units, rounding in the hospitals. I don't necessarily know that anybody could have been the operations manager. I guess it's just because I had done so many different positions, and I can kind of see things from different angles. You can see things, sometimes it bites me in the behind, because I look at it and go, why are we spending money on that? That's because I paid the bills at one time, or I did. And so it's a double-edged sword, because I will see things, and sometimes people go, it's okay, Lisa. It's okay. It's not your problem. Okay. But we can find it cheaper and do it, it's okay. I look at things in different ways. I don't know that the RN helps that in any way, shape, or form. But I guess it's just part of my background that just kind of went with it. I don't think it really benefits me to be an RN, but it doesn't hurt.
Big picture for like kidney care centers as a whole. What does the landscape look like currently? I guess let's start with the challenges. What hurdles, challenges are out there in front of you all right now that you are spending a lot of time on currently, or you foresee in the future, right, that you're going to have to address coming up?
The volume. So we have grown so much so fast that I think that's causing me severe anxiety because trying to figure out where we're going to put all the doctors. We had another practice join our practice this past January, so it'll be a year in January. We've brought them over. We had another physician join the east side, so we're growing. We have a doctor that's retiring in a year. Trying to figure out where we're going to go, what we're going to do, how to make more money, because Medicare cuts the amount they pay you. So that's not, everybody wants to make more money. How are you going to make more money when they're paying you less? So we're trying to find different avenues to make money. So where can we go to? We can give education. We can do things. Not only will it make money, it will educate patients. We can make the lives better for the patients that we're seeing now. Because I'm not a real big fan on the value-based care that's coming. I think it might be value-based care, but I think it's going to take away from the quality of care. There's going to be, I think the next couple of years, it's going to be difficult transitioning to value-based care.
What would you say, obviously, as more and more kidney care centers, right? What the biggest challenges are to continue that growth besides Medicare? Like, what are some of the biggest challenges you experience that you think maybe every kidney center in the country kind of experiences?
Workers in the dialysis units. I know that they've struggled getting staff. Staffing shortages all around, whether it's in the office for CMAs or but when it affects the dialysis units, then that's a problem, because those patients have to have treatment. There's nothing. I mean, we could close a clinic and say, close an office and say, look, we don't have enough staff today, we're going to move you to a different day. Dialysis patients can't do that. So that was a struggle. And then you have these travel nurses that come in, and that's scary for the patients. I think keeping up with the growth and getting quality workers, that's going to be a struggle that continues.
Makes sense. So flip that question. What is exciting about the future? Now, again, twofold, specifically for Renalus, but also to Daniel's point for kidney care centers across the country. Like what is a positive outlook out there? What are the things you're looking forward to, both for your specific group and then for this specialty as a whole?
The growth is good for our company. I think just being able to expand in larger and go in bigger areas. I think we're looking to expand on the east side and open another clinic further Freeport, Destin area. I'm excited because I think we're just going to keep growing. I mean, maybe we will merge with other companies. Who knows? I mean, you never know what's going to happen. But that would be exciting for our company. As far as kidneys, I just hope that they continue with the transplantation. I think if more patients could be transplanted and we didn't focus on the insurance aspect, some people can't go over here to get evaluated for a kidney transplant because their insurance doesn't cover it. And maybe one day that wouldn't be a burden for anybody to get sort of like a free school. You can go to any school you want to go to. You should be able to go get a transplant wherever if you have insurance or the money or the means. So.
Yeah. Obviously you're looking into technology to help what you do from an operations standpoint with your providers. What is it that most excites you about some of the technology that's coming out in the way that it's going to impact how you provide care to patients?
Oh, specifically the AI, just being able to write better notes. I mean, sometimes you look at the doctor's notes and it would be so much better if they could say what they want, sort of like the scribe, say what they are thinking, and it come out in a good way. Because sometimes you look at these notes and go, really? Oh, goodness, we need to fix that. But you can't. I mean, that would be better. I think just giving the doctors the tools to say what they're thinking and what they want to treat without having to spend so much time typing out or, we use Emodal, which is like Dragon, Fluency Direct, and it still messes up. I mean, we've had some really great notes with the wrong words. So
that's amazing. Well, shifting back, so changing subjects a little bit. You mentioned nursing school at 40.
Mm-hmm.
That takes a lot of courage. I love that. Oldest in the class, right? And then you have a classmate that said, let's go try dialysis. Any specific experiences? And you said, I loved it, right? She said you'd love it or hate it. You said you loved it. Any specific experiences during that initial exposure, right, to being a dialysis nurse that really made you understand why it was so impactful for you? Like what made you love it so much? Anything you can think of?
There are a few instances that I can remember that there was a gentleman that he was just very sweet. Every time he would, and I worked the same shift every week. I worked Monday, Wednesday, Friday, 15-hour days.
Wow.
But it's fine because I was off every other day. So I just developed such a great relationship with them. And he would come in the mornings and just jolly, one of my patients called me Joy in the morning, and I'm like, my name's not Joy. She goes, but you're Joy to me. And I was like, okay. It was just they treat you like their family because you spend 4 hours a day with these people 3 times a week. That's probably more than some people get with their own family. Yeah. So I had one that, I had to crawl on top of and do sternal rub and, flip the chair back because he was like but got up and finally woke up and threw up orange juice all over me. And I was just like, I just love this job. But it didn't matter. He was just so thankful that, I was like, I'm sorry. And I'm like, don't be sorry. I'm so happy you're okay. But those people it's such a rewarding feeling that even though I'm just kind of monitoring what the staff is doing, the technicians that are doing the work, they're so thankful for your time, it makes you feel good. I would go home feeling exhausted, but, nobody died today. It's been a great day. Everybody's alive. So, yeah, it is a rewarding, and I miss that part of dialysis. Do I miss the 15-hour days? No. But the friendships that you make with the patients will last a lifetime.
I'm sure that gives you a lot of purpose for what you do on a daily basis. I'm beyond maybe like that specific instance. I'm sure you see people from many different walks of life. I'm sure kidney diseases affect everybody, no matter where they're at. Tell us a little bit more about kind of patients and any specific stories or experiences you had from people that you built a relationship with that maybe you wouldn't have expected to build a relationship with and ended up being a good relationship.
Oh, I think everyone, I had to prove myself as a nurse because I think they kind of became territorial, and you'd come in and who are you? I'm the new nurse. Yeah, you're old. Yes, I'm old, but it doesn't mean I'm a new nurse, but I'm an old new nurse. But it took time, and once they realized that I was human and just I'm not doing anything against you. I'm here to help you. And I had patients would bring cakes, and it's like, stop bringing food. I don't need food. We would try to celebrate their birthdays or whatever, but it was like, don't bring a cake because if these people are diabetic, you don't want to, I couldn't really do that. But I look things differently now. So my husband was recently diagnosed with diabetes and on insulin and everything. And it was just like, and he was like, this is ridiculous. And I'm like, yes, but if you don't take care of yourself, you're going to be one of my patients. It's one of those things. You don't think about it. People with elevated blood pressure that don't, it's uncontrolled and they don't even think about it. Those are the ones that we have. Those are our patients. The diabetic patients that don't take care of themselves. those are the patients. So you look at life a little bit differently when you start out. And I've never been a hospital nurse, so I've only been a dialysis nurse. I was, from the moment I became a nurse, I went into dialysis, and then now I'm in the nephrology office. So people will say something, well, ask Lisa, she's a nurse. Nephrology, that's it. So I can't, I mean, people talk about other things, and I'm just like, no. Because I focused on kidneys, and that's all I've ever known.
That's awesome. Well, so looking kind of full circle here, your path has been an amazing story. Really enjoyed hearing more and more about it. Kind of wrapping this up. So you have wonderful patient experiences. You're super glad that you went into this field. You've also articulated, again, a lot of people that you treat in dialysis are people that maybe you wouldn't have expected to, or that, again, have not taken care of themselves. So from an advice standpoint, right, say that someone out there is listening to this episode and they're like, well, I certainly hope I never have to go to dialysis, right? What kind of advice would you give to the general population out there?
Annual checkups, get labs drawn. There's so many people out there that I've run across in life that are 40, 50 years old that have never had labs drawn. How do you know that, it's just preventative type thing. I would want to know, do I have an elevated A1C? How long has it been like that? Maybe I am pre-diabetic. Just the little things. And you don't have to spend a lot of money to find out just kind of your overall health. But if you do, if you're in the grocery store and they have a blood pressure machine, just check your blood pressure. Most people don't even think about that. It could affect the rest of your life if you ignore it. And that's just one of the things I kind of think about, the diabetes and the high blood pressure. Those are the two main reasons people go on dialysis. So just the little steps along the way.
Love that.
Do it. Check it.
That's great advice. We sincerely appreciate your time. Thank you so much
Thank you for having me.
being willing
great.
to sit down with us and tell us your story and share some insights about your path and your career. And appreciate you coming by.
Thank you so much for having me. This has been great.